Tonight we saw Marvin Harrison Jr.'s leg get tangled up underneath of him where he is hit by a defender, and it looks like his ankle goes into that classic ankle sprain position. The injury was severe enough to where he actually had to exit the game, and as of right now we don't have any updates on his condition, but based on the anatomy of the ankle we can determine what structures here are being affected. Since some people are not too familiar with the anatomy of the ankle and what structures can be affected here, I'm going to go ahead and focus on that with this video. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy, and with this channel I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over and expect a timetable for that person to return, and I'll go over best and worst case scenarios. If you like this content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now we see here on the injury replay that as the defender comes in to make the tackle, Marvin Harrison Jr.'s ankle just gets tangled up and it looks like it's going into, once again, that classic ankle sprain position. So here I have a model of the foot and ankle, and so the top portion of the ankle is formed by two long bones coming down to form the top portion of that. The first one being the tibia bone, which is often associated with as being the shin bone, that comes down and it's going to form the medial malleolus, or the inside portion of the ankle. Then as we look to the outside here, you have the fibula bone, which is going to come on down and form the lateral malleolus, or the outside portion of the ankle. If you feel on the inside and outside portion of your ankle right now, these are these two bony nodules. Then as we look inside the ankle here, this is the talus bone, and these three bones together make up what we know as the ankle joint. At the ankle joint, we have four main motions. The first one being dorsiflexion, where the foot is going to bend up this way. The opposite of that is plantar flexion, where the foot is pointing down like this. Then as we look at the model from this angle, as the foot comes in this way, this is known as inversion. And finally, the opposite of that is eversion, where the foot is going to be going outwards. Now, anytime a foot is going to go into the inversion or an inverted position like this, it's going to stress the structures that are on the lateral or outside portion of the ankle. So I want to go over the basic ligaments that are there. The first one is the anterior talofibular ligament. It's anterior, meaning that it's towards the front. The talus and fibula, talofibular, meaning it's going to attach those two bones. And this is also called the ATFL for short. Then as we move slightly posterior or towards the back portion of the ankle, we have the calcaneofibular ligament. Calcaneofibular, meaning it's attaching the calcaneus bone and the fibula. Then as we move towards the back portion of the ankle, we have the posterior talofibular ligament, or the PTFL for short. Once again, posterior on the back portion of the leg, and talofibular, meaning it's going to attach the talus and fibula together. One other thing to note is that when a person's ankle does go into that inversion position, it's also potentially affecting the medial and the lateral malleolus. So if you look at the model here, as a person's foot comes into inversion, if it goes far enough, it's going to excessively stretch the structures on the lateral portion, which is going to excessively pull on the lateral malleolus. And likewise, on the inside here, it's going to excessively compress the medial malleolus, also affecting it. So anytime we have a person that goes through the inversion ankle sprain position, it's also very important to note that the medial and or lateral malleolus can also be affected, as well as sometimes the talus bone. We do have a grading system for these ankle sprains. They are grades 1, 2, and 3. In a grade 1 ankle sprain, the affected ligament is going to be stretched. In a grade 2, this is where you're getting partial tearing of the affected ligament. And finally, in a grade 3, this is where you're getting a full rupture. A full rupture of one or several of these lateral ankle ligaments is essentially going to result in stability issues at the ankle. So as of right now, if it is just a ligament injury, obviously the worst case scenario is a full rupture of one of those ligaments. The most common one that is injured is the ATFL, but it depends. Another worst case scenario here is he's dealing with some sort of malleolar fracture or maybe even a talar fracture, depending on the excessive range of motion that his ankle went through. So in order to rule this out, basically what's going to happen is he's going to have an x-ray immediately to essentially rule out the fracture right away. One on the field test that we can do to determine essentially what ligament we think is being affected is known as the Taylor tilt test. So what we're going to do is we're going to take the model just like so, and we're gonna have the person's leg and essentially take them through that inversion position. Once again, going through slightly plantar flexed, neutral, and slightly dorsiflexed. So we can sort of isolate the ligament. And then from here, it's going to be followed up with an MRI. This probably goes without saying, but a timetable to his return depends on the grade of the ankle sprain and or if there is a fracture. Usually if there's a fracture, he's going to miss several months with this, as well as if he has one of those high grade ankle sprains resulting in a full rupture. But in order to know this for sure, we essentially need to wait and hear the results of an MRI and his x-ray. So once I happen to hear that, I'll be sure to update everybody in the comment section. Also, if you happen to hear it, please feel free to update me as well. So we wish Marvin Harrison Jr. the best of luck moving forward. We hope it's more along the sides of one of those low-grade ankle sprains. I do have some other videos where I explain those. So if you're interested, please feel free to click on those.